Good morning, everybody. It's chilly out there. It's 66 degrees. We're hoping it gets warm, and I'm sure it will. That's always in Miami. But say hello to Lightning. Lightning is my alpha cat. He's the number one cat. He rules the house, and he is my bud. He even cries if I don't give him attention. And when I leave, he cries too. So we're going to let him down. Go ahead. But today, we're talking about emergency surgery and why you should watch before you jump. But today we have two of our friends, Venus de Milo by Dolly. One is in dome glass, one is in bronze, and it's the woman with drawers. And you notice on the bronze one, the drawers come out all over, even in the head. Oh no, that one didn't come out, but it's so beautiful. And Dolly did such exquisite work. And the basis of this, among Salvador Dali's many memorable works, perhaps none is more deeply embedded in the popular imagination than Venus de Milo with Drawers, a half-size plaster reproduction of the famous marble statue done in 130 to 120 BC, altered with pomp decorated drawers and the figure's forehead, breast, stomach, abdomen, and left knee. The combination of cool painted plaster and slightly milk tufts illustrates the surrealistic interest in uniting different elements to spark a new reality. For surrealists, the best means of provoking revolution of consciousness was a kind of sculpture that, as Dolly explained in 1931 essay, was absolutely useless. That's Dolly. Dolly is so incredible in the work he does, and he is so beautiful, and he likes to take these things and impress upon them and then do his own design. And in the 80s, Dom worked with Dolly in doing these various pieces. But today we're talking about something. Don't rush into surgery. Had an incredible experience with a dear friend of mine who's been an attorney for 40 plus years. He was working out in his home, put up a new bar so he could do pull-ups. The bar fell. He fell on his butt from 4 feet in the air. He called me up. He says, Barry, I'm afraid to go to the hospital. Can I come over? Well, we did an exam on Saturday morning, x-rays. Didn't find anything serious, but it kept bothering him. I said, hey, we don't see anything on x-rays before going to the hospital or anything. Let's just wait and see. Well, Sunday night, the pain became very painful. So Monday, I called up, got him set up with a CT scan. He called his doctor up, a spine doctor, and he said, no, you got to get a CT spine immediately. Well, would you believe it? Within 15 minutes, I got him a CAT scan done. That afternoon, he sent the pictures over to a spine surgeon who he knew previously. The spine said, right now, you need to go to the hospital. You have a fractured vertebrae at T11. And he described more involved into it. And he became severely worried. He said, listen, you could become paralyzed from the waist down. And we're going to have to do surgery of fixing the spine from 3 vertebrae above T11, 3 vertebrae below, and freeze your spine. Well, this attorney was shaking. He thought his life was at an end. Besides, he's afraid of going under for any kind of surgery. He's afraid of anesthesia. So I said, hey, let me get the report from the radiologist. I got the report from the neuroradiologist, and he said it was an old fracture, and it's probably been there for some time. He didn't think it was a serious problem. Well, I said, wait a second. Before you run into the surgery, let me call my neuroradiologist. He checked the x-rays on Saturday and said there was nothing serious. And he looked at the CAT scan and said he didn't think it was a serious effect, and it's been there a long time. He had a lot of arthritis in his spine, which all of us do when you're 70 and over. Well, he started thinking about it. And he said, you know something, Barry? I called, put him in contact with a spine surgeon, one of the top in the country, and spoke to his managing assistant. And she asked him a couple of questions. One, what is your pain when standing or walking around? He says it's a level 1 out of 10, 10 being the worst. And when you're lying down, it's 6. She said, we're going to have the doctor look at it, and we're going to get him in this week to see him. She didn't, that's all she said. Well, we spoke to the 2 neuroradiologists. I discussed it with him. He said, Barry, I'm afraid of surgery. I listened to these 2 neuroradiologists. I'm going to see another specialist or 2 before I do this surgery that would completely affect and alter my life and cause severe, severe problems in the future. Plus, when you do surgery, especially on the spine, you never know how it's going to be. And a lot of times, within 7 to 10 years, a lot of times people need other surgeries. Sometimes you don't, sometimes you do. But before you do anything that's that severe, without the doctor even seeing you and just looking at CT scans or MRIs, you need to reevaluate it. The only difference is when, hey, you find you can't feel, start feeling your legs, your arms are feeling problems, but that's when you're talking about serious problems. But you really have to reevaluate and think about what you're doing, because some doctors are more aggressive than others, some are more conservative. My thought is, I'd rather you go to a couple of doctors before you get extreme surgeries, because that is a problem. It's a severe problem. The doctor told him, go to the emergency room, check in, and I'll see you so we can do your surgery immediately. Listen, I'm one, if it's necessary, you need to do it. If not, you don't. Before you jump into something that serious, it's got to be seen. I had another patient the beginning of the week, severe pain, 27. As soon as she came in, because we have an MRI, we did exam, x-rays, and MRI. I called the radiologist immediately 15 minutes later, and he gave us the results. He said, Barry, we have a severe problem at C5, C6. It really does not look good. Also, the vertebrae below it was also somewhat bad. So I said, listen, let's give you some therapy. Let's see how it is. On Wednesday, our physiatrist who does physical and rehab medicine, Dr. Stephen Burak, he took a look at her and he said, Barry, this could need surgery. We have to see about getting her checked by a spine surgeon. Well, the family contacted a spine surgeon. He saw how bad it was. She started getting numbness and tingling into her arms and hands, and the pain did not go back. After using the therapy for the first day or 2, it had some relief, but the next morning it was back severe. The doctor checked her into the hospital. He examined her, looked at the MRIs, discussed it with the family, and did the surgery on her. Thank goodness it was done on Thursday. On Friday, she was fine. There's a difference. But on the first instance, the pain was a level 1 walking and standing and ambulating, and laying down, it was a 6. There's a difference, but you need to make sure you check it out. And it's important to know your doctors and get recommendations from others to see how it is. Well, 2 severe instances, but you see how things are handled. It's important before you do surgery to make sure that you check things out and get seen by at least 2 doctors. If it's something severe, I have one of the attorneys I work with. Neck pain was so bad, it caused atrophy. And he waited a while, and because he did, his left hand can't completely open it up. You can't notice it, but I can, because as a physician, I notice these things that I see. Right hand is fine, but thank God he got the surgery when he did, because if not, it might have caused atrophy and he couldn't have used his arm or hand. So it's imperative when things happen to get them checked immediately, especially when it's severe and it involves the spine. Michael Miller is saying hello. Rebecca Fitt is watching. We always like to hear questions and people follow up as to what is going on. But today, medicine is a different story. Different doctors handle things differently. Sometimes it's hard to even get in to see a doctor. With a young lady on Monday, if I didn't have the MRI, she probably would have had to wait a week, 2 or 3 weeks to get an MRI. Who knows the effects? With the other gentleman, we got that CAT scan immediately and saw that it wasn't anything that the neuroradiologist did not think it was a serious ongoing problem from the fall. They felt that it was due to arthritis. Also, the doctor did recommend an MRI, which my friend is going to get an MRI to evaluate it also. This way, you're completely checked out. As I said at first, the x-rays were perfectly normal. It did show arthritis. It did show some other things, but it wasn't as serious as that spine surgeon told him that he needed to be. You know, it's so great being who I am, having the equipment, having the accessibility of getting hold of MRIs, CAT scans immediately, getting reports immediately, getting to speak to doctors live, both the neuroradiologist and the others. Marcia Gidney says hello. Old dear friends, it's amazing how people connect to you on the internet. It's one of the nicest things you can, especially as we get older, to see our friends and hear from friends that we haven't seen in years, and to keep in touch. And it's a great too when you get older how to keep in touch. Also, if anyone has any questions, please always contact me online or call me. My cell is 305-389-9513. I'm available 24/7. Also, too, we have 5 offices. My main office is in South Miami, where we have our 2 surgical suites. We have our specialists. We have our MRI and digital x-ray. And we'll get someone in immediately if needed to be. That's what we do at affiliated healthcare centers. It's really great that we can do what I can do to help people. During the pandemic, we were not closed 1 hour. We were open the whole time. We were taking care of people that were in pain and needed our care. It's amazing. It's amazing how we can and do help people. My cell number, my office is 305-666-8883. Meanwhile, our different locations are South Miami, West Kendall, Homestead, Tavernier, and Hallandale Beach Boulevard in US 1. Like I said, affiliated healthcare is the healthcare center with a heart. I want to thank you all for watching. And please share this with your friends, your family, people you know, and on the internet. Thank you. Have a great day. Enjoy your balance of your week. Thank you for listening, and bye now.